I'm Jane Stephenson and I'm the CEO at SPARK TSL. I've been working in industry for a number of years in the UK, primarily in healthcare, but my background really started in research. One of the things I found early on in my career is I'm absolutely passionate about bringing good ideas to market, especially in the healthcare field, to make people's lives better. I spent a number of years designing and developing the UK's leading maternity and neonatal system and looking after that company called CleverMed in Badgernet. I had an opportunity to move to SPARK just over 6 months ago, and I was really excited by this opportunity because it carries on with this passion around making people's lives better, especially at some of the most difficult moments in our life when we're receiving care or in hospital. At SPARK TSL, we're able to sort of connect not only what happens to the patient, but also wider within the community, ensuring that there's good Wi-Fi, good services, but also great entertainment and great engagement, empowering patients to look after themselves in hospital, understand what's going on with their care, and also ensure that the staff looking after them are given time back through routine tasks like ensuring the right member of staff is called to support the patient in their care. I spent a number of years, as I said previously, working to develop and design maternity systems for IT, for providing midwives and women access to their health records online. That experience of working with women, with midwives to try to improve care throughout the UK really has influenced our vision for what we're doing at SPARK TSL. It might not be known to everyone, but the UK has some of the poorest outcomes for women and children in terms of childbirth across Europe. That's not for the fault or the lack of care provided by people in the NHS. But we really have to think about how do we make that better? How do we make the experience better at a time when there's increased pressures on the NHS? We hear about it all the time, don't we? In terms of the pressure on midwives, the pressure on maternity services, and also looking at the outcomes of women and children and the experience that women have in hospital. It's so important that we get this right. Using our product, SPARK Fusion, women are able to access information online about their care and about the experiences that they've had in terms of childbirth. This can include anything like information on breastfeeding, or if they're in a unit that uses Badgernet, access to their maternity record online, Badger Notes, while they're still in the unit. It also can support midwives. Imagine a world where taking something as simple as the lunch order or the dinner order doesn't have to take away from care provided to the women and children, because that's all done through SPARK Fusion. There's so many more benefits, and I think when you align what we're trying to do at SPARK TSL with what we know needs to happen in maternity services, gosh, the sky's the limit. The NHS is faced with an incredibly large number of challenges. It's hard to open the news on any particular day of the week and not see a story about how pressured the NHS is. We know that in terms of time, in terms of staffing, in terms of budgets. It's unprecedented, the level of pressure that's on the NHS. And this is also in the face of an ever-increasing age and general population, which is requiring more and more care. Thinking about that pressure on the NHS, I think it's really important that all of us do whatever we can to ensure that we're supporting the NHS, both in terms of staffing, but also in terms of providing the resources that are necessary to improve care and improve outcomes, and also, importantly, improve patient experiences. For those who've spent time in hospital, who know what it's like, it can be a really scary experience. You might not know what's going on in your care. You could feel disempowered at any particular time. Having a tool like SPARK Fusion ensures that if the patient knows what's going on with their care, the ward staff are then able to focus on providing that care and ensure that people are working in harmony for the best possible recovery. SPARK Fusion can also save money in terms of ensuring that the right staff are there to provide care. For example, if somebody just needs something cleaned up, it doesn't necessarily require a ward sister to be called around to service that cleanup, Spark Fusion can ensure that the right member of staff and someone who has that responsibility is there on the day. That saves both time and money to the NHS. Thinking about outcomes, it's so important that we provide the NHS with the tools that they need to ensure all of us receive better care. Spark Fusion can be implemented very quickly and very easily across NHS trusts. Looking at our most recent installation in Stepping Hill, which is a hospital in Stockport near Manchester, we were able to roll out from the beginning of the business case through to the final installation of the 473rd bed within the unit, all within 3 months. The staff from Spark received a number of commendations and praise from the staff in the way that they were able to work in harmony with the hospital to ensure that they weren't causing any disturbances, and not only that, they made sure that the whole installation process was just super clean and super slick. It's really easy to do. SPARK TSL has already existed for over 20 years, and we plan on being the partner that's there with the NHS for the long run. In terms of the long-term vision of SPARK TSL, with Fusion, what we want to ensure is that we're providing a partnership for patient engagement across the NHS. Imagine a world where when a patient has a treatment or thinking maternity services, they're about to be discharged home, and all the information that the patient needs is right there on their bedside. So they can see the videos on how to care for their baby at night, or breastfeeding, or taking their baby in a car seat, or if you're on an orthopedic ward, how to care for your knee following a replacement surgery. That level of engagement will really empower patients to help be a partner in their care, which is really the future of the NHS. Especially as we see more and more trusts looking to provide community-based care and care outside of hospitals, Fusion can travel with patients not only within the unit, but also when they get home, ensuring that they all have access to the right information at the right time. Thinking again about the vision for Spark Fusion, it's not just about the patients, it's also for those providing care to those patients. How do we ensure that nurses and those healthcare workers who are providing care to patients have their time maximized so that patients receive the best possible care? We want to make life easier for nurses and those who are looking after people, and Spark Fusion can definitely be part of that journey. Fusion can support wards specifically in the NHS because it can be tailored for wards. So thinking about how care is provided in the NHS, there's a difference between, say, a pediatric ward and a maternity ward in terms of what you would want the patient to be able to access and what helps support their care. In a pediatric ward, for example, Fusion can surface information and services from the BBC that are appropriate for children, as well as games and things that children will be interested in to keep them entertained. For a maternity ward, we've spent time with midwives already in the NHS to discuss what has benefit both to the patient as well as to staff. I've talked already around some of the benefits that women can receive in terms of providing information related to their care. But there's also further benefit when you think about things like the Clinical Negligence Scheme for Trust, or CNST, which is the insurance that trusts have to pay, and reducing premiums by ensuring that women have had the right information. That needs to be very specific to the ward because those insurance premiums are linked to that particular area of care. We can tailor Spark Fusion to ensure whatever the need for that particular ward or that cohort of patients, Spark Fusion is surfacing the right information for their care. Spark Fusion has been installed at a number of sites, both across the UK and in the Netherlands. Looking at our two most recent sites in the UK, which are Stepping Hill and Leeds Teaching Hospital, just looking at some of the general statistics, we've had some excellent feedback on the whole installation process, working really closely in partnership with the trust, so that anytime there was any questions, concerns, queries, ideas around how to approach it, our installation team received excellent feedback in working to ensure that we were working, as I said, in partnership with the trust to overcome any obstacles. Thinking then around the next statistic, once the site has gone live, what we've seen is a doubling in usage in overall usership around the TV and the radio functions, as well as games and other features on the devices. Patients like them. They're great, they're easy to use. Looking at feedback from the trusts who are live, 80% or more have said that patients can access information independently to a greater extent than ever before. Overall, we take this as a really great success of SPARK Fusion as it's being rolled out across these sites. Ensuring data security and patient confidentiality is clearly a top priority. Looking at the news any day of the week, any of us can spot recent news stories where data and information has been hacked, causing real distress, both financially but also emotionally. Losing your data is not something small, and it's something we take very seriously at SPARK. To that effect, although we can integrate with hospital patient administration or PAS systems via HL7 and receive information from those systems around who is in whichever bed, Fusion does not store any patient data, meaning there is no possibility of a hack or losing data. It's a completely secure platform. In that sense, it's ideal for ensuring that it can be used in any environment in a safe and stable way. SPARK Fusion can integrate with a whole variety of apps and other devices. It can become your digital front door. So, for example, thinking about Operation Ouch on the BBC, we've recently put a link to that in pediatric wards in some of the units so that children can access that appropriate information that's surfaced via the BBC. Equally, we could integrate to other apps and other systems that are used by the unit, such as Badger Notes for maternity, for example. Although we don't produce these apps, we work in close partnership with other providers that do, to ensure that it's accessible via SPARK Fusion, making the offering even richer than it already is. Technology and AI is moving at a tremendous pace at the moment, and it's really important as a business that we continue to invest and ensure that we're also keeping pace. At SPARK TSL, we're fully committed to making that investment, and Fusion is just an indication of how we're delivering or sticking to that commitment. For those units who've seen it live, you can see that this really brings us into the modern age. And with some of the new features that are planned on the roadmap, we will be continuing to invest in technology and AI as this is rolled out. Linked to this, we also provide Fusion in a slightly different way, which is allowing for leasing of devices to ensure that technology in terms of the actual hardware used by patients is kept up to date and fresh, ensuring that the experience is rich and easy to use. For NHS leaders looking to invest in Fusion, normally there's a number of drivers that might be factoring into the decisions. One is, first and foremost, people want to ensure that their trust is providing optimal care. Fusion can support with that initiative and that agenda, and ensuring that patients have the right information and also that staff time is preserved for essential tasks. The second area that often concerns NHS leaders has to do with investment and funds. There's a number of funds that have been made available through the Chancellor's most recent budget around digitisation. That includes ensuring that all trusts achieve a certain level of digital maturity, for example, HIMSS Level 7. Fusion, with its features such as electronic meal ordering, can support with that journey and help unlock the funds that have been made available through the NHS. Finally, in terms of providing the feedback from patients and a good patient experience, that probably has to be foremost in everyone's mind. And looking at the feedback that we've already had from Stepping Hill around patients being able to access their information more easily, by empowering patients, we're ensuring that they have a better experience overall, and also making them a partner in their care. By investing in Fusion, it allows not only for the realization and benefits which save money, but also time and also improve overall experience, both for staff and for patients. Last year, we acquired a company called Sentient based in the Netherlands. Sentient is a company that's really closely allied with what we do, and it are the original designers of the SPARK Fusion product. They have a rich and really valuable experience of rolling out Fusion across the Netherlands, which has been amazingly successful. By bringing their knowledge into SPARK TSL overall, it's really accelerated our offering in the UK. And thinking about the ability to expand on technology and AI and investment that we were talking about earlier, that's really allowed us to almost springboard what we can offer in the UK. In terms of the Netherlands, by Sentient joining the SPARK family, they're able to benefit from our wider network of staff and resources within the UK, ensuring again that we're better together and we're a stronger company, able to move quicker and more thoroughly as we move into kind of wider opportunities. That includes integrations and everything else that we're offering within the product. Looking at the experience of Fusion in the Netherlands, they've had a number of years to be established over there and are now live in over 30% of the hospitals and still growing. As one of the leading providers of this service, it's amazing to see how many of the features that are already embedded in Fusion are rolled out in the Netherlands. Although they have a slightly separate model of care from the NHS, it just goes to show how flexible Fusion is in allowing whatever model of care is being used to be surfaced within the Fusion app. So for example, in the Netherlands, where you might have a mix of hospitals that provide for more private rooms, room control features allowing lights, air conditioning, shades up, shades down are incorporated into the Fusion app as part of the standard integrations. There's a whole raft of other features in Fusion as well that are available, like translation services that can also be brought into the NHS as well, especially when you think about the new hospital build programs that are being rolled out here and the increase in more private rooms and less multi-bedded ward rooms. Fusion has a number of key features. Starting at the very top and thinking about entertainment, that's what most people think of it first and foremost as. And of course it still does entertainment. It can link to standard TV programs, radio, hospital radio, as well as kind of paid for entertainment like your sports channels and everything else. That comes as standard. On top of that, it has a number of kind of communication features, allowing the patient to use translation services, allowing the patient to communicate anything that they need or want in terms of calling for the right person within the ward to support their request. So for example, if an extra pillow is needed, that doesn't necessarily need to be directed via the nurse, but can go to the right member of staff who could provide for that extra pillow, as an example. There's also a number of services that can be provided, including videos to find out about your care, meal ordering services. So think about integrating to ensure that rather than someone going around with a pen and paper and ordering meals, the patient can actually be enabled and empowered to do that by themselves. Having an elderly parent in hospital, I know that meal ordering is almost the #1 conversation I have with my own mum when she's in hospital. Finally, information around the hospital, around visiting hours, around anything else that you need for accessing the hospital, as well as to integrate things like to the local shops. So if you want to order a coffee and that's permissible by the unit, it can integrate to the local shops to order toiletries, whatever else is needed, and have that delivered to bedside. There's a range of other features, and I've talked already around some of the integrations that are available. But as I mentioned before, Fusion is really the digital front door, allowing the patient engagement side to be picked up by whatever is needed, and so that the patient can access whatever is needed right from their bedside. Thinking about Fusion overall, it has the benefits of being able to improve patient care and patient experience, support staff and save time for staff in providing care to patients, and save money for trusts. Throughout my career, I've been absolutely passionate around how do we improve overall care within the NHS. We all have a responsibility to do that. But with Spark Fusion, we can really make this a reality. If you're interested in finding out more, please reach out to us. We'd be happy to come on site and talk to you around how to make Spark Fusion a reality in your trust.